In a groundbreaking development, AI is reshaping how we treat and prevent diseases. Imagine a future where your smartwatch alerts you to potential health risks weeks before symptoms appear. This isn't a distant dream, it's becoming a reality. Traditional healthcare often focuses on treating diseases after they arise, leading to costly interventions and prolonged suffering. Preventative healthcare emphasizes identifying risks early to avert serious problems. Many patients still wait for symptoms, creating a reactive cycle that leads to complications. AI technology could change this. Recent advancements in machine learning and data analysis enable proactive approaches. AI algorithms can analyze vast amounts of health data, identifying patterns and predicting potential risks with remarkable accuracy. For instance, wearable devices can monitor vital signs and offer insights, helping individuals adjust their lifestyles. In 2023, research from Stanford University demonstrated that AI integration into personal health monitoring could reduce hospital visits for preventable conditions by 30%. That's a significant shift towards a healthier population. If the integration of AI continues to evolve, it may lead to a paradigm shift in healthcare. However, ethical implications must be considered. Privacy concerns regarding personal health data cannot be overlooked. What safeguards protect individual data? Ensuring that AI systems do not propagate existing biases is crucial. AI could empower individuals to take control of their health, changing how we view well-being. Imagine every person having access to a virtual health assistant powered by advanced algorithms that provide real-time insights and tailored recommendations. IBM's Watson Health exemplifies this, analyzing vast medical data and identifying at-risk patients with impressive accuracy. For example, it predicts diabetes-related complications with 90% accuracy, outperforming traditional methods. The shift from reactive to proactive healthcare can save lives. Reports indicate that up to 80% of chronic diseases are preventable. Startups like Grail are developing blood tests to detect cancer at treatable stages, demonstrating how AI aids in early diagnosis. Their Gallery test screens for multiple cancers through a simple blood draw with up to 95% sensitivity in asymptomatic individuals. Imagine the scene. A patient receives a call from their doctor, who informs them of an early cancer detection through a routine test they barely gave a second thought to. This groundswell of optimism sets the stage for a future where early detection is the norm. Competitors like Google Health and Amazon's Alexa are also stepping into the space. Google's AI predicts kidney issues with over 80% accuracy, while Alexa provides health-related reminders, showcasing diverse AI applications in everyday life. In one case, an elderly woman shared her experience of receiving a timely notification from Alexa about her scheduled medication, highlighting how technology can blend seamlessly into daily routines to promote health. Deep learning algorithms excel in pattern recognition. Convolutional neural networks analyze medical images to detect anomalies. Recent studies show that AI models can outperform radiologists in identifying breast cancer. A group of researchers from the University of California revealed that their AI model achieved 97% accuracy in detecting breast lesions, compared to 88% accuracy from human radiologists. This paradigm shift signifies a potential gold standard for diagnostics in the coming years. Despite the substantial advantages, the timeline for widespread implementation is complex. Transitioning from traditional methods involves rigorous testing and validation. Regulatory agencies ensure that these innovations meet safety standards. Approval can take years. Market readiness and consumer adaptation are also crucial. A significant portion of consumers remains hesitant about AI solutions, underscoring the need for education and trust building. The potential for personalized healthcare models is vast. AI-driven tools can forecast individual health risks and public health trends, allowing proactive community initiatives. Continuous analysis of health data can help identify emerging diseases, giving public health officials a crucial edge. Imagine public health agencies utilizing AI to predict flu outbreaks months in advance, leveraging data from myriad sources to ensure timely vaccinations and resources. This will transform the landscape of public health. Yet, challenges remain. Ethical considerations around privacy and data security are paramount. Sensitive health data collection carries risks, and biased training data can lead to misdiagnosis. Addressing these biases is vital for equitable health outcomes. One poignant example comes from a 2020 study that identified discrepancies in AI algorithms diagnosing skin cancer, where algorithms were less accurate for darker skin tones due to lack of diversity in training datasets. This reveals an urgent need for inclusive data practices. Moreover, reliance on AI might disengage tech-averse populations from their healthcare, exacerbating health disparities. Thus, educational initiatives must accompany technological advancements. AI should augment human decision-making, not replace it. Picture rural clinics integrating AI tools that collaborate with healthcare workers to enhance patient experiences, not replace the human touch that is essential in medicine. For AI's potential in preventative healthcare to be realized, well-defined regulations are essential. Policymakers must collaborate with technologists, healthcare professionals, and ethicists to create frameworks that protect individual rights while fostering innovation. The stakes are high, and the path forward requires vigilance. Consider a scene in a bustling urban clinic 3 years from now. Patients check in, not just with their ID cards, but also with their health apps open, syncing real-time data. A young woman, Sarah, strides in, confident and proactive. Her smartwatch buzzes softly, notifying her that her heart rate has been slightly elevated over the past week. Concerned but informed, she wants to discuss it with her doctor. This is a world where health data flows seamlessly and patients are engaged partners in their care. Historically, healthcare was reactive. It wasn't until the late 20th century that the concept of preventative care gained traction. In 1996, the U.S. Department of Health and Human Services published the Healthy People 2000 initiative, focusing on disease prevention strategies. This set the groundwork for future health policies aimed at reducing morbidity and mortality through preventative approaches. Fast forward to the mid-2010s, and the rise of wearable technology began to shift how people interacted with their health data. Devices like Fitbit can track physical activity, but they often lack in-depth analytical capabilities. Enter AI. It transcends self-monitoring by providing predictive analytics that can guide lifestyle changes before serious issues arise. The implications of this technology are monumental. When algorithms can predict a heart attack with up to 90% accuracy, patients can make informed decisions about lifestyle changes or request preventive interventions. For instance, an elderly man, Mr. Thompson, receives a notification from his health app suggesting a checkup based on changes detected in his sleep patterns and activity levels. That seemingly small alert leads to the early diagnosis of a heart condition, which, if left unaddressed, could have had serious repercussions. Picture the relief felt by Mr. Thompson's family when they learned the intervention saved his life. The breadth of AI's predictive capabilities extends beyond individual healthcare. Consider the public health landscape. Continuous monitoring of health trends through AI can empower communities. Health officials can analyze data from various sources, like emergency room visits and wearable devices, recognizing patterns of outbreaks. During a flu season, AI algorithms can analyze regional flu cases, predicting surges in certain areas and allowing local clinics to prepare accordingly. This is not just about treating individuals, it's about safeguarding communities. As promising as this sounds, the importance of transparency and ethical considerations cannot be overstated. Data privacy concerns remain a significant barrier. In the wake of high-profile data breaches in the late 2010s, trust in health technology waned. For instance, the 2020 incident involving a major health insurer exposed millions of records, highlighting vulnerabilities in health data security. Patients must feel safe sharing their data with the assurance that their information is protected and used responsibly. Policymakers must ask tough questions. How can we ensure robust encryption and data protection mechanisms? What frameworks need to be in place for accountability? Moreover, addressing societal biases is vital, especially in a healthcare system that has a history of inequity. Algorithms trained on skewed data can result in misdiagnosis or inappropriate treatment recommendations for marginalized groups. In 2019, a study revealed that an AI system used to identify high-risk patients favored white populations due to biased training datasets. This underscores the need for diverse datasets in AI training for equitable outcomes across demographics. Simple steps, like increasing diversity in healthcare data and models, can help ensure AI serves everyone fairly. Educational initiatives are equally crucial. Imagine community programs that teach populations how to interact with AI-driven health tools. Workshops aimed at older adults can demystify technology, fostering a sense of